Hey, GLP-1 plus sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.
Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better and my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our link tree to save some money.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster, confidence higher, price cheaper. See if you qualify at ro.co/TV.
Welcome to episode 22 of the Plus Sides Podcast. We're here. We're going to talk about Wegovy today. Wegovy and Novi. We're trying to decide what the title is going to be, but I'm thinking it's something like that. But we're glad to have you here. If you're new here, my name's Kim, or EMF Kim on Mounjaro, which used to be Dinosaur Monkey Farts. And the reason it was Dinosaur Monkey Farts is because when I joined TikTok, my little boy named me that. And I did not know that many years later, I'll be doing activism and obesity. So yay for weird things. But, if you are new here also, this is the Plus Sides Podcast, and we are working towards advocacy and education around obesity and related diseases and disorders. So that could be anything from type 2 diabetes, pre-diabetes, insulin resistance, PCOS, all the things, Hashimoto's, all the things. We talk about it all because it's not shameful. And we're sick. We need medicine. That's all there's to it. We're going to learn all about it. So we hope you'll hang with us. And I have been doing this about a year now, actually a year now. I've lost 66 pounds. I still have way to go. I used to suffer from obesity and a binge eating disorder. I don't have that problem at all anymore. I used to suffer from obsessive anxiety. I don't have that problem anymore. It's completely changed my life.
it's very difficult to wake up every morning and not be excited at this stage of my life. And did I think that was going to happen to me at 43 years old? No. So I want to celebrate it. I'm doing it here with my friends, and we are trying to help our community and move things forward and have everybody know that they are not alone. It's not their fault.
I am here.
That's what I'm doing here. That's why I'm here. What about you, Kat? Why are you here? What you doing? How's it going?
I'm here. I just want to say, first and foremost, it's still Mrs. Roper's summer, so I'm still wearing my caftans.
Oh, yes, you are. See, they can't see though. They can't like bask in the glory of the Mrs. Roper muumuus. I like the Mrs. Roper muumuus. I think they're cute. They look really comfy.
They're very comfortable. My husband hates them.
Well, I get it. It's not hot.
It's like wearing a huge nightgown.
Unless you're into Miss Roper, I don't know. You could be. You know.
Yeah, And if you're old enough to watch the show, you know how that was okay. The situation between Mr. and Mrs. Roper was pretty damn funny. But anyway, my name is Kat, Kat Carter 7 on TikTok, on the TikToks. I haven't done butt stuff lately. That's hilarious. But I'm starting to work. I know. I'm still working out.
Stuff. Wait, nobody knows what we're saying. New people don't know. Kat does
stuff with Kat.
And that is?
You don't have to have a Mounjaro or a Ozempic butt because we work out.
That's right.
And I saw somebody post like the other day, well, what about skinny butt? You can have skinny butt, but why do you want that? Like, why don't you fill out your jeans a little bit?
I'm not going to lie. I wouldn't mind a little skinny in my bootay. I have had a bootay since the beginning of me. I don't even know. It's just out there.
The muscle stops the sagging.
Have y'all seen me in those Judy blue jeans? My butt is OOC. There ain't no MJ butt there.
Okay, wait. You better start doing your squats before you get too far.
That's what I hear. My friend Kat is telling me this.
Mm-hmm.
It is popping, right? The booty.
Do it on your vacations, like I did in Nice, doing butt stuff in France on the
butt stuff
on oh my gosh, the Odyssey. What is Odyssey?
Homer's Odyssey.
Homer's Odyssey.
Butt stuff with Homer.
Doing butt stuff on Homer's Odyssey. Yes. But anyway, I will have some coming soon. I'm starting to work with a trainer, so I got some new moves coming up. And I am concentrating on adding a whole lot of muscle. I want to add a whole lot of muscle to my body, so I got to see how well that can prevent skin sagging.
We should do some butt stuff with Kat for our paid subscribers on YouTube. They would probably love that. God. It's like exercises with Kat, but funny. Yeah, you could play Prince music. It'd be hilarious.
I mean, what's the point of doing anything that's not funny?
Right, Vex.
That's why I work.
Clearly, we're talking about one of the most complicated subjects, right? And that can also be like very emotional, devastating. But we gotta laugh, so you're gonna get some jokes. Cats are comic relief faux shows.
They say comedy comes from deep trauma, and maybe I am that touched. I don't know, but
I'm sorry. I'm like,
you gotta be funny.
You gotta. What about you, JT? Who are you? What you doing? What you here?
Really touched.
Who are you?
Well.
Who are you? What you want? Why are you here?
I'm sorry. We are crazy silly today.
Today.
You know what? But that's a good thing. I am Janine, and I am the because the world can only take one. Even my mom said today, Janine, I need you to start working out. And I said, excuse me? And she said, yeah, your legs look really slender. Uh-oh. And didn't you say Kat can help you? I need you to take up with that.
Oh, I love Janine's mom. She's so feisty. Like, she's Scorpio like me.
What?
I hate spicy food.
Yeah, she is so feisty. And I literally was just looking at my phone like, what? Really?
Kat say she could help you with that?
Yeah, she did.
Put more muscle on. As we age, it is so crucial.
Y'all are supposed to go spin together, right?
Yes, your bones going to deteriorate and everything.
Yes, so I am on vacation this week, so I'm going to see when Kat is going to class, and I'm going because I'm ready, and I just need the extra padding for the cycle seat.
I have a cushion.
Yeah, because I have a little Mounjaro, but I do. But that's okay because Kat is going to help me regain my buttocks.
Yeah. Regain your buttocks.
Butt stuff with
We,
Kat.
in every class we do a little
Totally.
arms too. We do an arm song. It's lightweight, but
Listen,
just let you know it's a
listen,
full body
arms.
workout. Don't, yeah.
Look, from the rooter to the tutor. That is what we're going to work.
I
It's
love
from
it.
the rooter to the tutor. So
Your legs
That's a
are
new
gonna
I
feel
hashtag
sore.
too.
I am ready, but I'm so happy to be here with these ladies. Can I get my blood work done? I am a type 2 diabetic, and I also have an autoimmune disease. But with that, you know what? That makes me even more grateful to be on these medications and
Definitely.
to advocate for them to be more widely accessible, which is one of the reasons we're doing what we do. So there we go.
Yeah.
Right,
And we
there's
also
it.
want people to not have type 2, right? Like, I feel like all of my friends with type 2 are
Girl.
like, I don't want you to have this. Let's
Head
get you
off at the
better.
path. Let's do it now.
Yeah.
Listen,
Yeah.
if I could give the gift of friendship to you all and actually have it maybe be tangible or intangible, it would be that and anyone that knows me knows this, and I get a lot of flack for saying this. I do. But I said, if this can prevent one person from getting type 2 diabetes and being a part of an unfortunate number of us that are type 2 diabetic, I would give it freely, and I give it freely. I do not gatekeep Mounjaro. I do not gatekeep any GLP-1 because we are all in different bodies and we all have something. And this, and in the words of one of our guests, Dr. Catherine Toomer, the medication is treating something. So
if it's working, something's wrong. Like something was
if it's
wrong. That's why it's working.
something's being treated. So
Yep.
I'm just so proud of you all for advocating for yourself and for sticking up for your health, because I wish I would have had this 10 years ago.
Right.
Because then I may have been able to avert it.
Yeah.
You know?
Exactly. Yeah.
But that's okay.
Yeah, it is. And you're so lovely and healthy, and I'm just so happy for you. And, I know Kat and I really appreciate that you advocate for us as well to be able to take the medication. And like, that's something we really want our communities. We've said from the beginning that we really want to bring our communities together. Right. Because we're all technically in the same community. Like, that's the thing is like, whatever it is, we're on this insulin resistance spectrum together. You know what I mean? So like, we might as well look out for each other because no one else is looking out for us. We might as well look out for each other,
Yeah.
And there's always a popular culture reference I can take it back to, and you guys are going to cringe so bad.
Okay,
So it's
I'm
the
ready.
50th anniversary of hip hop. So
Yes,
we're all
it
in the
is.
same gang.
We sure are.
We totally are.
If you're old enough to remember that song. So just
50 years of hip hop. And
that song is 30 plus years old.
Which one?
We're all in the same gang. With like MC Hammer, was it? And Kumo D in it? And,
yes.
I don't know.
It was a whole gang. Anyway, see, I told you, it's just awful.
God, you're going to get me singing. Good God. You got a little bit of a lag with your internet, just so you know.
I was dancing.
Did you just knock over the thing with your dancing?
I did.
Yeah, that's what happened.
I was dancing. Okay.
Oh my gosh. Get situated. Kat, I told you not to get her excited like that.
Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs force me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Sides podcast is partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com/plus-sides. That's glpwinner.com/plus-sides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need.
20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
I know. Everything is a pop culture reference with
I know.
it can be rated or that
Now
or
she's
Prince
knocking
lyrics.
over her iPad. It's fine.
Listen, I know, and I'm like, oh, darn it, it is just falling. That's okay.
Okay, we're cool. We're good.
I'm good now. I'm good.
Now, there's a little bit of lag with your internet, JT, so just know that. We can hear you really good, but there's just like a slight lag, just so you know. So it's cool. So if we talk over you, you'd be like, holla, shut your pie hole so I can speak. Okay.
Holla.
Holla.
Gotcha.
All right, great. All right, so now that we've done our intros for a solid 11 minutes and been ridiculous, we're going to bring in the meat of this here episode.
Yes.
The meat and potatoes, because that's what we like here. Yes, we like vegetables too. Vegetables got a place. That's fine. But anyway, today that's what it is. And with us, we have Candace, who's going to tell us her community story about her experience with many different things that we are talking about here and the medications and what her life's like then and now and yada, yada. So without further ado, I'm going to invite her in.
Yeah.
Here we go.
Hi.
Hey, Candace.
Hey, Candace.
Okay.
Welcome to the
Sorry you had to
Plus
sit through that. I
Podcast.
apologize.
No, I don't apologize. It's good times.
It is.
I don't know about you guys, but I had a day, and it's just nice to come over here and hang out with some people and talk about the things that we're kind of all obsessed with.
Yes.
You know?
Yep.
But we're
been
so glad
like
to
a
have you, Candace.
continuous week.
Thank you so
Yeah.
much for inviting me. I really
Yeah.
was just like overjoyed when I got the message from you, Kim. So thank you, ladies.
Oh,
I
I'm
appreciate
so glad. I'm so glad. We're so glad you could be here for sure. So here is how we roll. We basically give our community guests the space to tell their story unfiltered, uncut, without interruption. You know, if we talk more, we wait until you're done. We have questions, we wait until you're done. I think that you deserve the right to be able to be heard. And this is meant to be a place of healing for all of us, as well as our listeners and viewers. So I'm so excited that you can be here. And as I've mentioned to you in the past, like legitimately every single time I do one of these episodes, I get a message that says, that sounds like me. I'm going to go see my doctor. And that makes all the difference in the world. That means somebody that may not have to die, right? Or may not have to be sick and miserable and sad and alone and all the things that we know come with these diseases and disorders. And that's huge. And you're going to be a part of that. And we're so excited that you are. So without further ado, I'm going to shut my pie hole and let you do your thing. Okay?
Thank you.
Go ahead.
Thank
Take the
you.
space.
So I said, how am I going to start this off? Because I can be long-winded, but
That's okay.
I just say when I started, I've always been that chubby girl, the big girl growing up into adulthood. Then I had my son at 21, and then fast forward 10 years later, I'm like, I'm still carrying on this baby weight. It wasn't no baby weight, those are just habits, that I just attribute to overeating and just living. Right. And so I joined a run group with some friends who I was spinning with because I was trying to exercise. I really did, but I knew the scale was getting up there. I was tipping the scale of 300 pounds. And I think that was my caution, okay, you're getting ahead of yourself. You need to pull this back. And so I joined a run group, Black Girls Run Clean. This was a welcoming space. I told them when they asked me to come, I'm not a runner. Look, I'm not a runner. I can't run. They said, you'll be able to run. And so I was able to become a run coordinator, was able to help other people run. Then I became a co-ambassador. So I led a group of 5,000 ladies that was on our Facebook page, and for 3 years. And then I run countless 5Ks, 10Ks, half marathons, and a marathon. But I was always that overweight runner. And so I did I did keto, plant-based, vegan, vegetarian. I used to go to the doctor and say, look, I'm running, I'm eating healthy, so to speak, but it was restricting. I can't lose this weight. I can't get past a certain amount. So I had lost 65 pounds when I first initially started running back in 2012. And then it was like my weight just was at a standstill. I had went to 3 different doctors. They were basically telling me I wasn't running, I wasn't exercising, which really bothered me because they wanted to say, hey, just have weight loss surgery. And that was always the thing, have weight loss surgery. And I'm like, no, there's literally something, I feel like it's something wrong. But years went on, life went on, I just dealt with it. And it was hurtful because people will look at me and say, you're doing something wrong. You're not really working out. You're not really eating healthy. And I'm like, I kept getting tired of really explaining myself, right? So it wasn't until the pandemic happened, 2020. My son he left for the Air Force. So I was an empty nester, dealing with what was going on in the world. So I had some depression, anxiety, and I just immersed myself into food, as well as picked up a hobby. And so a hobby that turned into a business, and I forgot all about running, exercising. I was DoorDash queen. I was just crazy. The scale went all the way back up all over again. So all the behaviors or good behaviors or healthy lifestyle I had adapted was not like part of my, my present. And so I had an episode in January of this year where I was on a live stream. And I was talking, and I quickly felt myself like my words were starting to slur. My vision was getting blurry. I couldn't see what was really on the screen. But as I started to get focused, I saw some people on the live stream say, drink some water. So I'm like, wow, they're seeing something that I don't know what's going on. So I quickly ended the live stream, put some water on my face, called my mother because I was frantic. Because prior to that, I had was having heart palpitations. I had went to the doctor. My primary care physician had told me to go to the cardiologist, and I did not go because I said I can't take off work. That's a big enough feeling, right? So I'm saying, I can't take off work. So I did not go. And so when I went to the emergency room, I walked in, my blood pressure was 185 over 89. And my weight was 291. My goodness. And I'm like, how did I get here? And I just was really just in tears because I knew my weight was creeping up, but how did I get to the point where I was feeling how I was feeling? And I literally thought I was going to die. I did not think I was going to make it. And so when I talked to the doctor, he says, your symptoms sound like you had experienced a TIA. I'm like, what is that? And he's like, it's a transient ischemic attack. It's a warning stroke. So you probably had episodes leading up to this moment that this was something that really just stopped you to say, this is what it is before it turns into a full-blown stroke. And so they prescribed me, they let me I was in the ER for a while to just get my blood pressure to come down to be a little normal. They gave me hydrochloride, which is a water pill, and a prescription for that. Told me to follow up with my primary care physician. I did on that Monday. I did. And she was so upset that I did not go to the cardiologist visit like she told me. And so she said, look, I'm going to write you a referral again for a cardiologist, endocrinologist, neurologist. I want you to see a dietitian. You've got to figure this out. You're 43 years old. At the time, my A1C was a 5.6. So she said, you're right at before pre-diabetes. You have a chance to kind of flip this around. And you want to be here for your son. You want to live your life. You're still young. And so at that time, it registered to me, okay, I'm going to take off work. I took off 2 weeks of sick time to get my life together. I'm like, I have to take care of me. And simultaneously, my mother was going through knee replacement surgery. So I was already off work to try to help help her and get her back going. So it was just a lot going on at one time, but I put my health first. So I went to see the cardiologist. I had to wear a heart monitor for 2 weeks just to monitor the heart palpitations, but that was attributed to stress. now that I look back on it, it was clearly I was just stressed out. They didn't find anything from the from the heart monitor, but he had me go get an echocardiogram. Got an echocardiogram, didn't see anything, but I was having these heart palpitations. So I asked for a second opinion. I went to another cardiologist, and because my sister, my deceased sister, she had a heart defect and she passed away many years ago. That was in my medical chart. This cardiologist didn't think about it. I talked to him verbally about it. But when I met with the other cardiologist, he said, I need for you to have a bubble study. And a bubble study is an echocardiogram where they take some saline solution, they shake it up, they put it in your IV. And when it goes on the screen, it comes up as bubbles. And if the bubbles cross over, it detects if you have a hole in your heart. It was detected that I have what they call a PFO, which is the patent formil ovule. And so people live with this. But what happens is we're all born with a hole in our heart, but 20% of us, the hole does not close after birth, and mine did not. So I live with this, right? And so if it wasn't for the TIA, I probably would have never found out I had the hole in my heart. Yeah. Now I'm on my third cardiologist to find out if I need to have surgery or not. But it was determined that it's probably not that severe, not like it's a huge hole. 20% of the population, you can have a long life, you can live with it and all that. But I was encouraged by the cardiologist to get back exercising. He was like, why did you stop running? Because that's your heart. That was keeping everything pumping and going. And I said, well, life happened. I just stopped. And so I got that straight. Went to the cardiologist, and then I went to the endocrinologist. That's when I had the aha moment. That's when my world just opened up and I had some hope. So I met with her. She took time with me. She looked at the last 10 years of my weight. She asked me what was I doing? And she said, you can turn this around. You can lose some weight. I can help you. I believe you have insulin resistance. She started looking at all my blood work. She ordered new blood work, and it was just like, I just had like a sense of just hope again. And so she said, I want you to go see a dietitian, but she educated me on Wegovy. So she's like, I think Wegovy probably would be the best for you. I was like, what is Wegovy? And she says, have you ever heard the jingle Ozempic? Oh, Ozempic. And I'm like, yeah, but I never gave it any thought of what that was. Yeah. Right. And so she told me about how this can help me with dealing with obesity, treating obesity, how it can help me with my high blood pressure, talking about insulin resistance and how it can look, because she has patients who are on Ozempic, Mounjaro, Wegovy. So she was well knowledgeable, which was helpful about the medication. She made me feel safe about it, even though I was nervous, injecting myself. I'm like, you got to do this on your own. Like, I don't need to come into the office and inject myself. She goes, no, you do it at home. So she was really just very educational. And I tell people to this day, your provider is how good your provider is how good your process or your journey is going to be, and how you educate yourself.
So true.
I agree. With the medication. Yeah. And so she says, well, I want you to, after I met with the endocrinologist, she said, I want you to meet with the dietitian. And she said, he's going to help you get you on the right track. I'm like, I don't need a dietitian. I know about all of this stuff. No, I don't. Because clearly I was restricting myself for many, many years from foods that were considered bad, right? I was diet culture. And I noticed that turned into me binge eating, because I restricted myself for so long. Then I would go on binges where it would be days, and I would eat in my car, so my son wouldn't know I had an extra cheeseburger and 2 apple pies. It just was ridiculous.
We're all in touch with that emotion.
It was just crazy. But I had to have the honest conversation with myself and say, hey, if you want to do this and you really want to tackle this, you have a chance. You got to be honest and tackle some things that you may have avoided. So when I spoke to the dietitian, he said, listen, I want you to focus on your protein. I want you to focus on your water. I want you to focus on not restricting yourself. I want you to be able to have a slice of pizza, enjoy the pizza, and be done with it. I don't want you to say that you can't have it. The only foods that you say that are considered bad are ones that just don't feel good for your body. And you'll learn that as you pay attention to what you're eating, And I quickly figured that out. I can't have fried chicken anymore. I love fried chicken. Oh, no. But fried chicken doesn't do well for my body. It doesn't make me feel good. It just upsets me. So now be on this medication, I just don't have fried chicken. I just put things in the air fryer, So I just learned to adapt to different things, but that was really me having those honest conversations because I'm an emotional eater. So the times when I would say I need to get something to eat, early on when I started Wegovy, I'm like, no, you don't. Sit down. You don't drink some water.
Yeah.
Walk around the house, So
Sit
it was
down.
just, you have to have
Sit
those
down.
honest conversations with yourself.
Yeah.
And I
I do
think
all
that's
the time.
been the change for me.
Yeah.
It's actually going through that. And then as I started Wegovy in February of this year, so that was shortly after I had the TIA, maybe 3 or 4 weeks later, I noticed that the food noise went off. And oftentimes when I'm talking about food noise, people are like, what is that? Always thinking about food,
Yeah.
always thinking. It just was like a light switch. It went off. And I'm like, I'm not thinking about what I'm eating for lunch. I'm not thinking about eating dinner. I'm not constantly just all this chatter in my head. It's like I get to think about other things. And that was one thing that I really, really enjoy about this medication. And also, too, I don't eat as much as I used to. And it took me a while to kind of dial back to say, okay, you cannot fix your plate the way you were fixing it. I was just over eating. And so oftentimes people will say, well, that's too much. Well, how do you eat all that? And that's a conversation that people say on TikTok. That's just too much. And that's how, it depends on what you know that your body can withstand. And oftentimes when I'm showing my food, I can't eat all of it because I listen to my body. And now I'm making sure when I'm satisfied, I just stop. I push it away. If I come back and maybe 5-10 minutes later, if I'm still hungry, I'll have some more. If not, I'll put it for leftovers. But it's no more of that. When I was growing up, I was learning I had to clean my plate before I got up, right? That was a bad,
Me too.
right? That was
Same.
a bad habit that I just grew up learning. I had to clean my plate. Now I don't feel bad with putting it away for leftovers. If I don't want anymore, I'm just not going to eat it. So I've learned.
Plus, pizza tastes better the second time, right?
Oh my God. Yes, ma'am.
It does.
Any Italian food the next day.
It does.
It does. So this Wegovy just gave me just a brand new outlook on life, health and wellness. Once I was cleared to go back working out, because my cardiologist didn't want me to start back with high impact aerobics. He said, just walk. And that's what I did. I just started walking. And then when he cleared me, I signed up for a gym. And so now I work out between 4 to 5 times a week. I still go walk with a friend. I enjoy working out only because there was a time when I just couldn't do it. So I look at that now. I can't be able to do it again, and what it could do for my body. It helps me not just physically, but also mentally as well. So I really enjoyed that, and just meal prepping again, enjoying cooking because I love to cook, but enjoying new recipes and just sharing my journey with the community that I found on TikTok. That has been amazing.
So fun, right?
Yes, it has been amazing because I didn't want to do it on Instagram. I didn't want to do it on Facebook. I said, let me just check TikTok out. I already had a TikTok account for my crafting account, but I said, let me see. And I was amazed. I mean, I found all the Mounjaro people, but I was amazed how many people were on this medication and how many people were actually dealing with the same thing that I was dealing with. It just was a different medication, right?
Exactly.
And so I started documenting it, and I wanted to put a different spin on Wegovy. I came across the horrific stories about people having the worst side effects they were. And I said, you know what, if I talk about it, I'm going to talk about real, but I want to kind of put a different spin on it where you have to pay attention to how your body is going to react to it. Because, we're different people. The medication is going to affect you differently. And oftentimes people don't know that because they hear, oh, you're going to experience this. I have people that would inbox me and say, thank you for sharing, because I've had the box of Wegovy in the back of my refrigerator for like 2 months now, and I've been scared to take it. So this has just been a game changer, life changer, and it's a tool. And I tell people, it's like, you have to put in the work as well. That's one thing that my doctor told me. You have to change the way you're eating. You have to, exercise. You want to definitely strength train. She really is on me about strength training. So to make sure I can minimize as much loose skin as I can, but also build muscle mass. So I actually want 3 free months of personal training at my gym. I just was told today I got 3 months free.
3 months.
So
Wow.
I'm very excited about that.
Awesome.
So I had to submit my story, and the young lady watches me at the gym when I come there and take classes. And she was like, I love that you were just doing this just trying to get your health back together. So you're already on it. I just want to help you more. So I'm like, that was just the icing on the cake. So
That's
yeah,
awesome.
that's really it in a nutshell. So here, 28
Yeah.
weeks later, 44 pounds down,
Oh my
16
gosh.
inches. Yeah, 16 inches overall. I just feel great.
Woo! I bet. I
Yes.
bet you do. That's awesome.
Look at
I think it's
you.
interesting. Like Kat and I can for sure totally relate to the emotional eating. I think like, and I'm curious, like if you're open to some questions, are you?
Yeah,
Like
yeah,
they'll be happy ones, I promise, like friendly ones.
yeah.
Um, I remember that moment when that like everything turned off for me, like the emotional connection to food. Speaking of food, I'm moving this food right here because my dog's trying to get it. Go away. You go. Sorry. It's just life. It's life. This life in the Carlos house. Okay. We have 4 dogs. It's crazy. Anyway, but I remember that like when that happened and that being like so bizarre. And it's interesting what you said, because I know you and I both run small businesses. So it's like, and work. And it's amazing what you can do with the capacity that your mind has when you don't have all that noise all the time, isn't it? Like it blows my mind every day. That's what I was saying. Like I wake up in the morning and I'm just so excited. Like I'm so
Yes.
excited about the day and what it's going to bring.
Yes.
I don't think I felt like that since college. I'm not sure I've ever felt like that. It's incredible.
A different feeling.
Yeah.
You hate to say it's a weird feeling because you never felt like
Yeah.
this before. I'm like, is this what
Yeah.
everyone else feels like when
I think so. I think maybe.
Did you guys used to wake up those some mornings where like you'd been doing great for like several days and you wake up one morning and you are ravenous as hell and you're like, oh
Yeah.
crap, today is going to be a struggle.
Yes.
Like I just know for a fact today is going to be I'm probably I'm going to try not to even claim
I
it,
still
but
have
it's gonna
those. I still have those days. But the difference is, Kat, is when I go to do it, because I'm like, I'm doing it. I'm hungry. I got to do it. And then I do it and I don't though. Like legitimately, even on the medication, like it does stop me. I don't know how to describe it. Like, I just, but
remember
when
how
I'm
it
in
used
it,
to be, though.
when I'm going for it, it's the same feeling as how it used to be. Like I am going for it. I know that I am hungry. I know that I need to. It's that same like biological feeling.
Lay off me. I'm starving.
Yeah. And then I go and I eat like 6 bites and I'm like, yeah, that's it. That's it right there. That's some 6 bites.
Yeah, you
I
allow
did
it.
the job.
Yeah.
But I remember those days.
Recognize
I was
those
like,
feelings. You want to recognize those feelings because they're going to be there,
Yeah.
And sometimes I'm like, am I really hungry? Am I not? So I just try to talk myself out of those things. But if I want, like I tell people, if I want some ice cream, I'll go to the ice cream store, get my favorite ice cream. I have it, I enjoy it, and I move on. It's no more regret.
Yeah, totally.
I lived in the land of regret. Like, oh, I shouldn't have had that ice cream. I don't say that no more. There's no reason to say it.
No.
Yeah, I don't either. No, I'm done with those days. I don't even live like that anymore. I just prioritize protein, and I try to eat more vegetables. It's easier because I like them better. Like my whole palate has changed.
Yeah.
And that changed with me. So I started on Ozempic and then eventually went to Wegovy. Just because, Ozempic ends at 2 milligrams and Wegovy goes to 2.4. And those medications changed my life, but I'd been at a year and I was on 2.4. And so it got to the point where it was like, what am I going to do? I've got at least another 65 pounds to lose. Like, what am I going to do? And then I got approved for Mounjaro. So I was able to take it, which is incredible. And I'm like, okay, like there's more doses. I can go a little bit longer. Like, you know what I mean? Yeah. So I think they're all really wonderful. And like, for those that are listening that are curious about the different medications, because we've talked about Mounjaro, we've talked about Ozempic, we talked a lot about Mounjaro on the show. But honestly, like in my opinion, and I don't know if anybody else will feel this way, but I think they're all the medications are like great in their own way. They're like different employees that all get the job done. Mm-hmm. And I've been, even though I had to do step therapy and it was a pain, honestly, it's kind of nice that I can like attest to that. Like my experience was actually very good on all of them in different ways. It did get the job done. It did in the food noise, it did in my obsessive anxiety, it did in my binge eating, and like all of them did that. They're awesome, So I don't like when people get upset and think, oh, I can't get Mounjaro. What am I going to do? You know what I mean? It's like and what's so great is like when Sexton and Victoza, when that patent is up this year, there'll be generic ones next year. And I think that'll be such a good on-ramp for people that haven't been able to afford to take these, At least that's what I hope. I hope that for people. I hope.
I agree.
I fingers crossed.
I think it'll happen. Be optimistic. Yep.
Yeah.
Yes.
Be optimistic. Don't you be a grumpy. What is that from?
I was thinking of
Whatever.
the other
I don't
one.
know. That was so
I'm not
random.
sure about that.
I was thinking of the gospel group from Minneapolis.
I know.
Oh, that's
Yes.
way different.
Be
Sounds of Blackness.
optimistic.
Yeah. The
Sounds of
optimism.
Blackness.
That was way off.
Yeah, everything goes back to something sort of music.
We were
Musical.
thinking the same thing. I was just
Yes.
like optimistic.
Y'all are you when
Right.
it comes to
Sounds of
music,
Blackness.
y'all are almost always thinking the same thing. It's so funny. And I'm just like, okay.
I want to know what the song Kim is singing because it says, "Don't be a grumpy." I like
Don't be
that.
grumpy. If the road
I
gets
know.
bumpy, just smile, 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 and be happy. Anyway, whatever.
Did that come
I
off a
digress.
cartoon?
No, it's from a movie. I just can't remember which one.
Oh,
I don't
okay.
know.
Okay, movie.
I can't remember. I'll think about it. I'll put it in the show notes. Anyway, back to the show. So, Candace, before we move on and invite in Mad Indo, also known as Melissa Young, Doctor MD, before I add her in to talk with us about your story and ask her all the questions in the land so we can validate your experience with facts, science, and data. Do you have anything else you want to share?
I'm sure. This is one question that I do get
Sure.
from people asking me about prior authorization with
Yeah.
Wegovy. So my
Mhm.
experience
Yeah.
is different because I didn't go into my doctor's office knowing I was going to get Wegovy, or I just came in there just this was a checkoff box with my primary care physician. And
Yeah.
so what she told me was the clinical criteria I met, but she was going to write me a prior authorization, put in with my insurance company. She wanted me to go home, call the insurance company, find out if it's even on my insurance plan, because a lot of insurance coverages, they weren't covering it. And then also find out what I would have to pay. And so I like to tell people now is if you have an idea or a thought that you want to try a GLP-1 medication, you want to call your insurance company to find out, does your plan cover any of these medications? Because actually I'm having that same conversation with my sister. She's actually going through a similar situation that I went through. And I'm like, hey, I have some experience. I could be able to help you. Call and see if Mounjaro, I'm giving her the whole list of gamut of things to find out, because then when you go to your doctor, you can have the list of the medication that is approved or covered by your insurance company. And then your doctor will take it from there. And my process was fairly easy. And I know sometimes it's not it's not an easy process, but ask the questions, hopefully get somebody who's patient, who actually takes their time and is not rushing you. None of this stuff. Can you please help me? And then I did find out that I actually only have 8 pens approved underneath my prior authorization.
Oh
and it's only for 6-month authorization. Now I've had more than 8 pens. So I don't know what happened with the insurance company, but when I had got my letter, actually it comes up August 17th is when my doctor needs to put in another prior authorization.
Yeah.
But she's familiar with the process. She was like, I know what I got to write in. So that's another thing, having a doctor who is knowledgeable about the prior authorization process, because she'll take care of the appeal and all of that. She knows what information to put into it. So I'm a little nervous because I'm hoping that I can still continue on my Wegovy journey, because that's the only option I have. I don't have a Saxenda already here is now like on a back order. I know too. Wegovy.
All of them are. Saxenda, Wegovy, Ozempic, all of them are having problems.
Yeah,
all of them. It's
just
absolutely asinine.
It
I
is.
just talk about screw. I'm sorry, but all of you manufacturers, you are screwing the pooch. You need to get it together. Get it together.
And then I heard Wegovy is now going into 2024 with their shortage.
Yep, that's what I hear.
So, indeed.
That's what I hear. Yeah.
But people are
my sister just started and is having a hard time finding it. Yeah, people can. I mean, like, it's not like, and I think they're getting it out there. Like, it's just, it's limited, and it's like chilling on some shelves. You know what I mean? Because people are like, oh, people don't know any better, right? Or like, oh, I guess I can't try to get it because it's not available. A lot of people think that, and it's a really good way to control demand, right? And it's brilliant. They're diabolical, but brilliant. But yeah, that's super good to know, because like at the PA process, I feel like is such a big pain in the butt. And it is interesting. Like my insurance only does it for 6 months at a time too.
Okay.
And but they don't do it based on pens, but it is 6 months at a time. It's crazy, but every policy is different. And like, that's what I tell people, like when we do lives on TikTok, is like, don't think just because, your friend that has Blue Cross is able to get it that you, or isn't able to get it, you will not be able to get it. And I think also people need to consider medical necessity, which is something you should consider.
Mhm.
because if you need to take Ozempic, right? So because Ozempic and Wegovy are the same medication, right?
Right.
So if you can't get your medication on Wegovy because of shortage or because of stupid PAs or whatever it is, you have medical necessity,
Yeah.
right? And your doctor can make a case for that. And it's a pain in the butt, but if you need to, you can, you know? And
Yeah.
there are other people out there that I think don't know that. And it's difficult and it's hard to do, but it is possible and it does happen for people, you know? So I hope people just don't feel not hopeful, you know, because there are options. But yeah, so just in case, like check and
No,
see if you
thank
need a
you.
PA.
Yes.
Check
Yeah.
and see if you need a PA for Ozempic because you may not
And
need
I
one.
don't. And it's crazy because I have a $200
Wow.
copay with Wegovy.
Yeah.
And with
Yeah.
Ozempic, it's $25.
Yeah. Isn't that crazy?
No.
That's how,
Yeah.
no kidding. I'm with her. It's the same thing.
Yeah.
My insurance doesn't require it either. It's the same medication.
Wow.
I think
crazy.
they'd rather you take it because it's less expensive and you have the
Yeah.
same medicine. It's just smoke and mirrors. That's what I tell people. Like whenever we get friends that, come on that are like, why don't you just take Wegovy? That's the one for weight loss. No, actually they're the same thing, but they don't know. Like they're falling for the marketing and the smokes and mirror. And who wouldn't? You see these things or
Right.
medicines, they have a brand, you just kind of roll with it, but like that's not the case at all. And that's the same thing with Victoza. It's just the dosage that is different, but it's the same medicine. I wonder what will happen with Mounjaro. I don't know. I wonder if they'll come out with a higher dose. I know we're gonna find out soon. We're a few months away, I think, at most, and we'll find out.
Mhm.
I think
Yeah.
I'm gonna be really excited if I'm right. I'm not gonna lie. I'll probably do a dance. It'll be a good time.
In your Judy blues.
Anyway, in my Judy blues with my booty lift. I was like, it ain't lifting my booty. My booty look good though, but it ain't lifting nothing. Like maybe if you don't have a booty or you have a weight loss booty, like maybe I'll lift it for you, but mine's just hanging around south, where I'm from.
Mine is deflated.
Yeah.
I never did. So I need to try the Judy blues. I keep on hearing about
Candace.
Oh yeah.
Candace, Judy Blue and Risen.
You gotta try
I
it.
will send you links. I TikTok shop them. I will. I'll send you links. All right, cool. So hang with us if you will, because we're going to invite on Dr. Melissa Young, and we're going to talk about all these things a little bit more, and we hope you can stay. And if you ever have to go, you just let me know, okay? Hello. How are you?
What's up?
I'm fine. Thank you for having me back. I guess you didn't learn your lesson the first time.
I guess not. Clearly.
Look, no.
Or maybe I did learn it and I just want you to come school everybody again, This is Mad Endo on TikTok, also known as Dr. Melissa Young, who has come to hang out with us. She's an endocrinologist and knows a lot about the disease of obesity, PCOS, all the things. And we're going to talk about all that today. And I'm just so glad to have you. But for those who don't know you, can you tell us a little bit about you, like what you do and how you help people?
Sure. I am, as Kim said, I'm an endocrinologist. I've been in practice, I'm not sure I want to say how long, for over 20 years. I do general endocrinology. There are some endocrinologists who will specifically just do pituitary or just do thyroid, but I do general endocrinology. So although the majority of my patients do either have diabetes or thyroid disease, but I also see people with other hormonal disorders, low testosterone, pituitary disorders, adrenal, and so on.
Right. Okay.
I don't specifically treat weight loss or treat obesity as a separate thing, but many of my patients, they come in and when I ask them, have you been since last time? One of their first complaints is, well, I gained more weight. We kind of end up on that path many times.
Yeah, makes sense.
Yeah.
So I think what I'm noticing is that a lot of times people are like, what kind of doctor do I go to for these medications? And in my research and, experience thus far, it seems like to me that these medications are complicated and they're not always easy to dose. And the disease of obesity and all these related disorders are very complicated as well. So sometimes you can't always get care from a GP where they may know about these things to properly handle, your care on this journey, which is long, and so and you can tell me what you think, but it seems like bariatric doctors, endocrinologists, and obesity specialists seem to understand them best. And so I would like to know a little bit about
what is an endocrinologist? Like what are you actually looking for like in the body? What is your like expertise in that area so we can understand what that means?
So endocrinology is the branch of medicine that deals with hormones. And a hormone is, most of the time when people think of hormones, they only think of estrogen and testosterone. But a hormone is a substance that's made by a tissue in the body that travels through the bloodstream and affects other organs. So, as opposed to, say, a salivary gland. The salivary gland, there's a duct and the saliva goes into the mouth. And so that's not a hormone. But insulin is secreted by the pancreas. It goes through the bloodstream and it affects many organs. And so that is considered a hormone. So we treat it, again, in general endocrinology, we treat many different hormonal disorders. There are, sometimes people ask me for me to check, quote unquote, all their hormones. And I said, I can't do that because there's hundreds. And so when we check hormones, we need to know which one we're checking and why, because there are, depending on what the symptoms are, there are different things we're going to look for.
Yeah. Yeah. That makes total sense. Yeah. I can imagine that is a very complicated field to be able to like whittle down and find out kind of what it is. A lot of investigation, no doubt.
Especially when you say like
in terms of
your patients,
go
I
ahead,
check
Chuck.
all my
Go ahead, Chuck.
hormones. People don't realize that's like checking all your
There's
nerve
a bunch.
endings. Like,
Exactly.
Right.
Again, I think it's because they think we're just talking about estrogen. When the women come, they want their estrogen, progesterone, but when they say all, I don't think they mean all. But that's what they ask for. They're like, well, I can't do that. There are some that need to be checked in the morning and some need to be checked at night. Some I need to do urine. Some I need to give you medication before we check. Some require you need to be in the hospital to check. So you can't just say check them all.
Wow,
yeah, totally.
Right.
You have no blood left.
That's true. I get that. So in terms of like the endocrine system, how is that connected to things like preventing stroke or heart disease and things like that?
So that's kind of a complicated question because there are many, because hormones affect a lot of different organs in the body. Yeah. So there are many endocrine disorders that can have an impact on atherosclerosis. Primarily, just from a number standpoint, a prevalence standpoint, diabetes is going to be a very high risk factor. It's actually considered a heart disease equivalent because people who have type 2 diabetes are at very high risk of developing atherosclerosis, blockage of the arteries, and so that increases the risk of heart attack and stroke. But there are other, endocrine disorders that increase that risk as well. And just having the disease of obesity, because it, and people don't think of obesity as a hormonal disorder, but it is, because again, we're talking about, the hunger and the satiety hormones, ghrelin and leptin and so on. Mm-hmm. And when the fat cells, when the adipose cells fill with lipids, with fat, they secrete these pro-inflammatory substances, and that increases also the risk of developing atherosclerosis. And again, it's that blockage of the arteries that increases the risk of heart attack and stroke.
Okay, that makes a lot of sense. Okay. Wow. So when I know recently you had talked about Novo Nordisk, and I remember seeing a TikTok about it where you were talking about like how it has like helped with, well, it was like a study, and it was a big study. I think I remember. And you were talking,
trial?
Where they were specifically.
So the SELECT trial looking at semaglutide 2.4 milligrams, so Wegovy at the highest dose. Yeah. There's, I think, 17,000 people in the study, and it was placebo controlled, which means that, a certain number of people were on Wegovy and a certain number of people were not. They were on placebo. And when they looked at, and these are people who had known heart disease, when they looked at the incidence of what's called MACE, major adverse cardiovascular event. So that's death due to cardiovascular disease, heart attack, and stroke. The people who were on semaglutide had a 20% decrease in their risk. So, and when you look at weight loss by other means, people who diet and exercise and able to lose weight, or even looking at bariatric surgery, there is a decrease in MACE, but not 20%. So there's something else that this drug does that decreases the risk of cardiovascular events.
That's
And
amazing.
then
It's not
isn't
a
there
surprise because we
GLP?
had that data with Ozempic already years ago.
Yeah.
We already knew that, and that's at a lower dose. I think that like
Yeah.
a 26% decrease or something in the study that they did for that. So this is not a surprise at all.
So what was the high dose you said for this study?
2.4. So
2.4.
the max
Okay.
dose of
The max
Wegovy.
dose.
Yeah.
Okay.
Yeah.
Wow. Fascinating. And isn't there GLP-1 receptors on the heart?
You know what? I don't know the answer to that.
I don't either. Let's find out. I'll find out and I'll put it in the show notes. I don't know. I feel like, I don't know. I was wondering if that's what it was. It's cool. You're not a cardiologist. I understand.
Gotcha.
Kat, I think
Okay.
you had a question.
I do. How can years of yo-yo dieting affect your endocrine system? Impact,
Ooh.
effects, things like that.
Mm.
Because
Well,
that's we're all here for that.
also, when someone gains weight, again, there is an impact on those hunger and satiety hormones. And so people who are overweight or who have obesity, when they feel like their body's fighting against them, when they try to lose weight, they're not imagining that. That is true. They are hungrier. It takes more food to make them feel full. And this is, particularly true also in people who have type 2 diabetes because of the insulin resistance. And when people have insulin resistance, when they have type 2 diabetes, the other hormones that are affected is GLP-1, the incretins. So the body becomes resistant to GLP-1. And so GLP-1 is supposed to help you make more insulin when your blood sugars are high, and help with satiety, but their body doesn't respond to the amount that their body is making. And of course, there's a decrease in insulin, there's an increase in glucagon, which leads to the abnormalities in glucose. So there are many hormones that are affected by weight gain. And then when you try to lose weight, again, there's this dysregulation in the hunger hormones, which makes you feel the need to eat more. So when people are faulted for their lack of willpower, it's a brain thing. It's a hormonal thing. It's not that intellectually, these people know that they shouldn't eat as much. But they have this need to do so. Their brain is telling them that they need to eat.
Wow.
So it really is not like when they say it's all in your mind. It actually kind of
it's kind of true.
Is, right? Yeah.
Yeah.
Brain. It's in your brain, which is different.
Mind and brain, different things.
Mind and brain. I get it. Yeah. And speaking of I was so excited to talk to you about this because this is like what my mom would always harp on about so much cortisol is affecting and putting all this belly fat on you. And it's these cortisol drugs. So I really want to hear from an endocrinologist. What truth was it to those infomercial pills that said they would reduce your cortisol and your belly would shrink? If there was truth at all.
If there was truth, then we wouldn't need Wegovy. While it is true that excess cortisol causes weight gain, the amount of cortisol that you can make physiologically, unless there's something actually physically wrong with your adrenal gland or with your pituitary gland telling your adrenal gland to work harder, you just can't make enough cortisol to be the sole cause of the weight gain. Having said that, there are some physiologic things that happen. So people who are shift workers, people who have to work at night, because their daily normal cycle of cortisol production is thrown off, they do have a harder time losing weight. People who have sleep apnea, again, because they think they're sleeping, but their brain keeps waking up because it's trying to keep them breathing. Again, their baseline cortisol levels are higher, so they also have a harder time losing weight, which is a vicious cycle because the weight gain increases the risk of sleep apnea. The sleep apnea makes them gain more weight, and so on.
Yeah.
But these pills that are available that allegedly lower your cortisol, no.
No.
The short answer is
Sugar
no.
pills. Oh, wow. See, don't buy that stuff off infomercials.
Don't waste your money. You must save it for your copay.
Agreed. And we need those. We need those copays, right?
Yeah,
Yes.
totally.
And speaking of copays and your adventures with PAs,
Oh.
your pharmacy adventures, the last one was Doctor of Comedy or something that he shared. That was it was truth and so much humor to it, but sad and true. If is that what you call it? But anyway, could you share with us some of the special or the scenarios of that you as a medical professional experience, and also do you see it as something that we just have to endure for a while?
Oh.
Um, or
Unfortunately, yes.
is
I mean,
there a
like
light?
I said, I've been in practice for 20 years, and it was not this bad 20 years ago.
Oh,
I
it's
want
gotten
to
worse.
say in the last 10 years, it's gotten worse every year. Part of it is because we have more meds and we have more brand name medication, but also there's been a lot more involvement from the PBMs, the pharmacy benefit managers.
Mm.
And so, and for those who don't know, the pharmacy benefit manager is the middleman company between the patient and their insurance. So patients often think it's just their insurance, but the problem is you have the pharmaceutical company who makes the drug. Okay. Then you have the insurance company that is supposed to pay for the drug. But then there's the pharmacy benefit manager that is supposed to negotiate the price between the pharmaceutical company and the insurance company. But of course, somebody needs to get paid there. Right.
Right.
The insurance companies get paid, the PBM needs to get paid, the pharmacy needs to get paid, and the pharmaceutical company needs to get paid. And guess who pays that? That's
We do.
us. That's our premiums, and those are our copays. And so the PBM's job, in addition to negotiating between pharmaceutical companies and the insurance company, is to save the insurance company money. So they will do that by, again, first by negotiating prices, but also by limiting what patients can get. And so when they negotiate with the pharmaceutical companies, they'll say, okay, if you give us this good deal, then you will be our preferred brand. Right? So they will want all patients who need something in that class to get that brand, unless they have a history of not tolerating it or having an allergy to it or something like that, which is where the prior auth comes in. So the prior authorization is, and they're going to claim it's for patient safety, but that's part of my language. That's bullshit. It's not for patient safety. That's all about cost savings.
We
So
appreciate your
when people
candor.
ask questions, they're going to claim that they want, and to a certain extent, they want to make sure that drugs are prescribed for the FDA approved use. Okay. And then they're going to want patients to use the least expensive drug that they can before they approve a certain brand name.
Mhm.
So when it comes to the GLP-1 receptor agonist, if someone has type 2 diabetes, it is much easier to get approval for Ozempic than it would be to get Saxenda or Wegovy, because technically, even though Ozempic and Wegovy, as you said, is the exact same drug, because the brand name Ozempic is FDA approved for diabetes and the brand name Wegovy is FDA approved for weight loss, getting treatment for type 2 diabetes is so much easier than if someone does not have diabetes and they need a GLP-1 for weight loss. There are some plans that just have a blanket, we don't cover weight loss, period. I was just working on a PA for one of my patients last week, for Saxenda. She has type 1 diabetes, but she's noticed that she's needed more and more insulin. So she's starting to develop some insulin resistance, and she's gained some weight over the last few years. So I sent a prescription for Saxenda. They made me do the prior auth. I don't know why, because their answer was, we don't cover this, it's a plan exclusion. And then they sent me a copy of her plan, what's covered, not covered, and weight loss treatment of any form is not covered. No meds, no surgery, no nutritional counseling.
Wow.
So it all depends. And someone had said earlier, it's not so much the company. Well, it's the company, but if one person has Horizon, another person has Horizon, that doesn't mean you have the same plan, right?
Yeah,
so you can have a plan under Horizon that covers everything. Our state workers, they get everything. So if I have a patient who's a teacher, I'm like, oh, don't worry, you can get whatever you want. but if you have Horizon from a small company,
Mm.
they might not cover anything. I have some where they don't cover injectable medications, period. Which
Whoa.
is ridiculous. So
Wow.
yeah, so there are different sub plans and carve out and things like that. So the prior auth process, first of all, it delays care because it can take several days,
Yeah.
sometimes weeks.
Mhm.
And if they deny it and it's not an exclusion and you need to do an appeal, that's
Mhm.
another couple of weeks. And if they deny the appeal and they want you to do a peer-to-peer, that means that you're supposed to talk to another physician in the company,
Yeah.
which is ridiculous because it's never a peer.
Yeah. It's never a peer.
Talk to an ENT to get a insulin
Wow.
pump. And I'm like,
Wow.
Oh, dear God.
they're not even the same specialty, but I digress. So then again, that's another delay because it's not like you call and get the doctor on the phone. You call and they ask you when you're available. And they say, well, someone will call you on this day between the hours. It's like the cable guy. So he'll call you on
It
Thursday.
sounds like it.
Oh,
Yeah.
I hate that.
Yeah.
Yeah. It's like, here's a window. And if you're lucky, if I
Here's a
come.
window.
Yeah.
We're gonna deliver your washer and dryer. Just wow.
Yeah.
Right. So I've had to do peer-to-peer driving in my car because that's when it happened to call. And I have to hope I have
How
everything
often-
memorized.
How often when you do a peer-to-peer, do you feel like it goes through, like when you get to that stage?
Yeah.
If you get to that stage, most of the time it gets approved because at that point you are actually talking to a human being with a medical
Yeah.
degree. And
Yeah.
either they will look at whatever you submitted and again, the ENT knew nothing. So all he could do was say, okay.
Yeah. Sure. All right. That makes sense. Yeah.
ENT.
Not that we don't love our ENTs.
They
We
know that
just,
what you're doing is reasonable.
yes. Like we're happy with the ENTs. We just don't think you should prescribe obesity medicine.
Yeah,
That's
no,
all.
that's
Like,
fine.
that's all.
I have an ENT. I love her. But you can't tell me whether or not I can prescribe an insulin
Yes.
pump.
Right.
Exactly. Totally.
Wow. Well, that right there is a perfect segue to my question. We were talking about how you had shared with your audience that Cigna is facing a lawsuit and denying claims because physicians weren't actually viewing the claims. It was done like with AI technology or something like that. So, do you see more of this coming to light with other insurance companies, and what has been your experience as a provider?
Oh, good
I
question.
wouldn't. I'm fairly certain that they're all using some kind of algorithm because the turnaround time is way too fast for them to get a hold of a physician to review it.
Yeah.
So the problem is when we fill out the forms, it's a lot of yes and no.
Yeah.
Did they do this? Did they do that? Yes, no, yes, no. And so they're just going off a checklist. And if you answer one question wrong, quote unquote wrong to them, that's it. They deny.
That's it.
So it doesn't give you a chance to explain things and ask for exceptions and so on. So I'm sure that off the bat, many claims are being denied just based on algorithms. And then it requires an appeal. And it's not till there's an appeal that there's actually someone who looks at it. Yeah.
Wow. Okay. So, and like Kim and Kat, all of us were saying that once you get to the peer-to-peer stage, I guess they're saying, well, heck, if like you've gone through all of this, the least we can do is listen and I mean, probably give an approval. So I get it. I know when I had my prior auth in January, it took them like 3 to 5 minutes to approve. And I was actually on hold. And they said, oh, okay, well, you're approved. I'm like, oh, okay. But it took almost like 3 weeks for us to even get them to look at.
Get to that point. Yeah. And
correct.
It is actually a little frustrating. It's satisfying and frustrating when after waiting all that time, finally getting them on the phone, takes them like 30 seconds to say, oh, okay.
Yeah.
Right.
Yeah, because mine was the lag time, like with the holidays. So, and then we switched from UHC to UMR, which is still UHC, but just a different company. So the next question would have to be, your poetry is the best on your TikTok. So
We love your account.
we love it. And we just want to know, could you share with us the Mounjaro Haku? Yeah, maybe.
Was the side
That
effects
was a
one, right?
while ago. I did have to look at it again today. Right. I have to get to haiku mode.
Okay, ready.
Okay.
We're in a place to
Again.
proceed.
Now, this was a year ago, so it's not a new drug anymore. But at the time, let me think about it for a second. Okay. New drug. Mounjaro. Lowers glucose. Weight loss too. One shot once a week.
Love it. Haiku.
One shot once a week.
Haiku.
I love it. That's all the commercial needs to say.
Right.
You know?
I know.
They should.
They need to pay. You need to be.
They don't need a jingle. They need a haiku.
Ooh.
It's just straight into the point. I love it.
I love
One
it.
injection once a week.
Yep.
That's it. Well, my last question, Dr. Young, is how often can GLP-1 meds, get approved off-label for medical reasons other than obesity?
To be honest, I have not tried to get them approved for anything other than obesity or overweight with comorbid conditions.
Okay.
And even with that, there are some plans that make it impossible.
Yeah.
Wow. Okay. Okay.
Yeah, I hear it's really difficult. I had heard that, and this is when I say heard, I mean like all the doctors I follow on TikTok, that they will, or that have been on the show, that it is hard to do. But again, like if it's the weight loss exclusion, it's really difficult if you lead with anything weight loss.
Yeah.
So like anything as you're trying to do anything with weight loss, like it's probably going to get denied. But if you have like with Ozempic, with them having a lot of peer-reviewed studies and articles and things like that, that they were, not that it was easier, but that it was more like possible or probable to be able to do like Ozempic off-label if an insurance plan doesn't cover Wegovy, for example. But I also heard from a lot of them that it could take months,
Yeah.
So
Wow.
I just was curious if you had any experience.
Ozempic, I think, would be easier, for, again, type 2 diabetes is on label, actually. Might be easier for insulin resistance, PCOS, but you'd have to have a plan that's a little lenient with things.
Yeah.
Again, if it's a plan exclusion, then they don't even let you appeal.
Wow.
They just send you it's a plan exclusion, case is closed, and there's no conversation again after that.
Gosh.
Wow.
Such a problem. Ugh.
Wow.
Awful. Yeah.
So one thing people can do is they can talk to their HR and see if they can switch plans or something like that, or if the company can get new plans during enrollment time so that they can choose a different plan.
Mm-hmm.
But some companies, again, because you get what you pay for.
Yeah.
Plans that have lower premiums will pay for less stuff. And so if your employer is paying for part of your premium and they don't want to pay as much, or if they think, well, maybe the employees don't want to pay as much for their premium. So you're going to so you pay less every month, but you get less out of it.
Less covered. Yeah. I think it's interesting. I've been trying, and I'm just going to kind of keep singing the song until people start singing with me. Nat and Doe. I feel very strongly that people deserve to have their disease treated. They're recognized medical diseases with FDA approved medications to treat them. I think it's insane that that's not allowed. And I think it's awful. And I think that in order to be inclusive at a company and have an inclusive benefits package, that under diversity, equity, and inclusion, you should have that. And I feel like if people would get some chutzpah and go and tell their, benefits people, hey, you are always talking about DEI. where's the DEI in our benefits package right now, right here? Like, because this should be here. It is a stretch. It is difficult because I think DEI, from what I've learned in industry, is very much centered around race right now, because we know it's a big problem, right? But this is also a big problem. And I think it's something that we have to talk about, and it's a conversation we have. It's going to be uncomfortable, but I'm hoping that our audience will try to take that when they're going to their benefits department and see if they can work it under that, because it makes complete sense. It does. Like, if our friends that have type 2, which is a chronic medical disease, right? We already know that it is, well, we know it's proven, it's recognized, it is treated medications. Why wouldn't you do the same for its sister chronic medical disease and get it treated? You know? Now, I don't know if that's going to fly, but I have heard some people have had some luck. So I don't know. I'm just going to keep singing it. Y'all just keep singing it with me, and we'll just hope good things for people.
Well, I don't disagree with you, but you're right. It's going to take a lot of work by a lot of people to make that happen. Because unfortunately, despite the fact that we know it's a disease.
Yeah, we know. Yes.
Not everybody accepts that it's a disease.
Yep. That's so true.
Indeed.
Which is crazy, especially in our country. Like, other countries, it's different. They're not always treating it like a disease. You know, they don't all recognize it that way. So I don't know, but it's bananas. But I hope it changes here. We're just going to keep talking about it on the plus sides. We're going to keep marketing the plus sides. We're going to keep getting as loud as we possibly can, and keep getting sponsors that help us do more paid marketing so that we can get louder and louder until we're super annoying and things change. Because that's how things work.
And we have more
Consider
fun
us
doctors.
a thorn.
Yeah.
Yes. And we
That
are
come on and give us
sides.
haikus.
Yes. Have good haikus. Yes. So important.
You just follow me on TikTok.
Yes. Matt Endo on TikTok. You have to follow
Matt
him.
Endo.
And I'll include everybody's socials.
Haiku. Oh, I have to make a plus size haiku.
You do have to make a plus size.
I'm
haiku.
excited.
Can you do it now?
Yes.
All right.
Can you do it now, like off the cuff?
No, I cannot.
Oh. What if I talk to Candace for a minute and then I come back to you?
I gotta think about it. I'll put it in my notes and I will make the TikTok.
Okay.
soon.
Can we put it on our YouTube channel?
Surely.
Just put your little, like, when you do it, make your like mention on there so that like they can see it and go follow you. And put it on the YouTube channel.
Absolutely.
And I'll put it on the TikTok channel too.
Okay. Note to self.
Note to self.
Note to self.
Plus
Make a
size
haiku. Plus size haiku. I love it. Awesome. This has been a lovely conversation, ladies. Thank you so much for joining us. And Candace, thank you for being brave and sharing your story. And thank you for talking with us about Wegovy and all those.
I was sitting in the green room thinking, I just want to listen to her. I don't know why they want to talk to me.
Because you validated. Dr. Young, validation. These are part of it's the haiku. It's the validation part. It's got to be in there. Because that's how you change a narrative, right? You can't just be like, hey, feelings. And because I say so. You have to be, hey, yeah, feelings because I say so. Logic, facts, science, data. Now argue with me. See what I'm saying? That's what I'm trying for. Sing with me. La 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 la. Sing
We're
along.
getting ideas from that right now.
Right. She's like, notes. Awesome. Well, I've taken up quite a bit of your time, and I very much appreciate you guys joining. And thank you so much. And when everything posts, I'll send it over to you so that you can share it out. Okay.
Thank you. Yes.
Thank you so much.
Thank you all so
for having me
much.
again.
Candace, thank you.
Bye,
Matt and Joe.
Butt stuff with you.
I'll do butt stuff.
Love it. I love it.
Oh, you gotta put it in the haiku.
Something about
I'm being pretty demanding. You don't have to do that. I'll make you know what? You gave me a great idea. I'm gonna make a butt stuff haiku.
Yeah, you better. All right. I like it. All right. It's haiku day.
Yes, ma'am.
It is.
All right. Thank you so much, guys.
Bye.
I'll be exiting you. Stay
Thank
left.
you.
Bye.
Good night.
Good night.
What a lovely conversation.
Gosh.
I love it. That was so fun. I love Menendo. Candace was a doll. Yes. Everything we hoped.
She?
Everything we hoped. Yes.
Isn't she precious?
Creepy, weird thing.
Uh-oh.
We've been looking at Candace for a while but she was early in her journey. And we were like, let's just watch her.
Look,
let's watch her.
like
She needs to have, she needed to have all the realizations, right? And we didn't want her to
We just want to make her have her journey. When it'd be like up in her grill when she just got started. And then once we were seeing her like posting and choosing all the things, JT was like, this one. I'm like, yeah, that one.
I'm like, yeah, this one
This
right
one.
here.
Yes.
This
Hand
one's a good
selected.
one.
Awesome. Well, it was such a good talk. I loved hearing more about PAs. And I love, if you guys don't follow
Me
Matt Endo,
too.
she's a trip and she gives such good information. And she also has on her channel, she's going to like a whole series of like questions for PAs that are complete bullshit. Like it's just the stuff that she has. Like they're like, does your patient plan to become pregnant? She's like, no, she's 65. Like, I hope not. And like stuff like that. It's so funny.
It's like,
she's like, they're awful. They're the worst. But it's another example. Like they're just trying to make things as difficult as possible so that we just go away. But here's the thing. We're not going away because now we know what's on the other side of this rainbow.
You just have to get past that ultimate monster in those video games, right? You gotta keep going.
Yes, it's the Bowser.
Level.
Oh,
the what?
Cat. The Bowser. You have to fight the Bowser. You know.
Okay, we need little
this
man
is the pop
to
culture
do
thing.
all the whole thing for us. We need the dinosaur monkey farts originator. We need a new feature in the show.
Yeah. Because
what is the feature? The boss?
We don't know what
he's the gamer.
Yeah.
He is the gamer. Yes. He knows all about the mega bosses. Really, Daddy is the biggest gamer, but he's definitely second. The man of many faces. If you guys don't watch us on lives, we talk about it there. We have Crime and Punishment every Friday, which is a segment that my son, who is very into the podcast and advocacy now, which is adorable, does Crime and Punishment. And we pick the nastiest, meanest comment of the week. And then we talk about how stupid they are. And put them to shame and then laugh. And then that's about it. Like, we don't show their names or anything. It's just, it's just fun. It's just fun. It's Crime and Punishment. He just thinks that people should pay. He has a very strong sense of justice, this little guy. So
we didn't call your husband Country Justice at work for nothing.
Country Justice. That's right. He also has a very strong sense of justice.
Country Justice.
Country Justice.
We called him Country Justice at work. Yeah.
He is going to be our live guest this week, our community guest. And we're going to talk about his experience. And then he's also going to talk about like what it was like being married to me and like seeing me go through things. That's what he wants to talk about on the live.
So
he'll talk on Friday.
That's interesting.
Although the people that are listening to this, it would have already happened by the time you heard it. So just go back. It'll be on demand. You can watch it on demand. It should be interesting.
Exactly.
Yes. Awesome. Well, let's do our sign-offs. Anybody have any NSVs or any new quotes, Kat? Any new songs? Nothing?
Well, I did have an NSV again, but it's similar. It was another pair of leggings, another pair of activewear. I used to get these activewears that would fit, but they would slide down my butt because they were a little bit too tight.
Yeah.
So I'd be working out and I'd have to pull up my britches. Right?
Did you say britches?
I said britches.
Yeah.
Yes,
Georgia,
my hybrid Midwestern Southern accent, it comes out.
Britches.
Pull up the britches.
Pull up the britches. So I pulled on a pair of those capris this morning and threw them on, and now they slide down because they're too big.
Huzzah. That's a big deal when like activewear falls off.
Yes.
Because it's like
I am not parting with it. Activewear is freaking expensive.
Activewear is very expensive.
And you can rock it a long time. And like, even if like I'm still wearing mine and it looks ridiculous, but it hangs out on my tummy and then everything else just looks like I'm in a tent,
I decided to start, because my husband is such a fashion man, and he started to really joke me on, tease me on, because I like him, I'm kind of fashionable by myself, but my husband started to check me on my workout ensembles, and he would be like, are you wearing all the colors today? You're missing gray.
Oh my gosh. What
are you going for homeless today? Are you going? No, my husband would.
You'd be like, "Are you going for hungry today? There will be no cupcakes for dinner."
Right, none. Cakes, cupcakes, nothing.
So
no cakes for you. No kind of cakes.
Exactly. Well, he would say, he likes me to stop making those cakes because it's tempting, and he's trying to, lose his 3-month baby's stomach.
3-month baby.
Aw.
I thought you were going to say
He got a
3
little
pounds.
teeny
I want
weeny
to lose
stomach.
3 pounds.
It looks like
Everything
he's
lately
about
with
2
me has
months.
been mean girls. I don't know what the deal is. I want to lose 3 pounds. 3 months is different.
Yeah.
That's a pooch.
So I have dropped some serious coin on my activewear. I don't go cheap.
Yeah.
Well, I get
No.
expensive stuff for inexpensive prices, but that's all I wear too. You
Yeah.
know. So
Yeah.
no, I'm not partnering with it until it like falls off my butt. Like I can't
Yeah.
pull them up.
I usually go
Yeah.
to Old Navy. They like have some decent wear.
Activewear.
Yeah.
They
The cat
can.
is so
I
active and has
shave.
all the
Oh, okay.
sweat and all the. She
The
always talks about her
rubbing,
sweat.
Yeah.
Yeah.
the
Mhm.
chafing.
Mhm.
She's very
Yeah,
particular.
and that has it's I listen, and they have to pass the squat test. You know, when you squat, and then you can see
Oh,
all your
yeah.
bloomers.
Yeah. Your
Make
bloomers.
sure you're not wearing a
Britches and
thong
your
that day.
bloomers. Yes.
And you know,
Britches and your bloomers.
britches and
I love
bloomers.
it.
You know what? I'm going to go on one more tangent here. I remember it was a couple
Okay.
years ago.
Tangent.
I was in
Go to
I was
France.
in a spin class from France,
Yeah.
and she was wearing these really. First of all, she had a phenomenal figure. I have to say, I was kind of like, wow, she's pretty hot.
Cat.
But she had on this cute Adidas suit, matching everything. She was coordinated. She was fly as hell.
Nice.
But I could see her whole thong. She was right in front of me, and I was like, I'm looking right at your butt, and all I can see is your whole thong.
Yeah. It was like
And
distracting from the cuteness.
I'm just
Because of
like,
thong.
no. On one thought, I'm like, I know Adidas activewear is not cheap. She
Yeah.
spent all this money, and you could see her bloomers all the way through. I saw the whole thong.
Oh,
And I was like, well,
Why are you
thankfully,
even wearing a thong though? If you're working out and it has
different
that's
strokes for
weird.
different folks.
I mean,
I don't
literally.
like it. I don't
Yeah.
I
like
don't
it.
like thongs, period. I just don't like
And
them.
some people
And maybe
don't
it's
wear draws, and I'm like, no, raw
draws.
booty.
I know.
I will
Now
pass
we're
on.
at draws.
No, I can't raw
Draws and pantaloons and
That is
Draws.
raw booty.
Yeah.
Yeah,
I get
raw
it.
booty.
So
That's
Kat,
Raw
is that your sign off?
Raw booty.
Raw booty is her
Right.
sign off.
You have
Alright.
to wear bloomers underneath
like
your
it.
activewear. That was right. But anyway, so
Bloomers.
thankfully I was behind her because the army of men in the weight room behind me would have had a whole show. But
For sure.
anyway.
They would probably like that though. Sometimes
Yeah.
people do that for attention. Maybe they like it. I don't know.
She might
Whatever.
have.
I don't know your
I
business.
Look,
would, I could see all the flowers on your underwears.
I mean, maybe
Underwear.
that's why she got the flowers one.
And that's why that's where I get pricey activewears because
Yep.
no bloomers, no
Yep.
thongs show through.
Yeah.
And
Yeah.
no chafing.
All right, that was a solid tangent, but a good sign off. I bet you, JT, you
Solid.
got anything?
Solid.
What is it? Marathon but not a sprint? Is that what you're gonna say?
No.
What you gonna say?
My NSV for the week is I've literally had 3 people walk right past me because they said they didn't recognize me.
That's amazing.
That's a big NSV.
You do look very, very different. You know?
Yeah, and then you have your
Yeah.
hi, I'm 25 hairdo now. Like you look like half your age.
Well,
Yeah, for
look,
sure.
literally. But
Gorge.
thank you. No, I mean, like for work, I have to have my hair back.
Yeah.
And I walked by and I said, "Hey," and they were like, "Yeah, hey," and I'm like, "Okay, what did I do?" All I said was hi.
Yeah.
And I circled back. I'm like, "We've known each other 20 years." And he literally was like, "Oh my gosh, Janine, I didn't realize that was you."
Yeah. Crazy.
And that's the 3rd time that it literally happened 3 times last week. So
Wow.
yeah,
That's crazy.
Major. Big
Yeah.
NSV.
That must be like just bizarre to have people like not know who you are. And you're like, don't you know me? What are
it
you?
was very, very
Yeah.
weird. I mean, even people at my church, they're like, "Who are you?" I'm like, "I'm Janine, the chick that sits over here."
I love it. Are people asking you, I'm super curious. Are people like, how did you lose the weight? Are they asking you that yet?
Some are, and believe it or not, a lot of people still have not heard of GLP-1s. Maybe they've heard of Ozempic, but
Yeah.
they are very curious about
Yeah.
it. And you know me, I am open. I I like spread the
Yeah.
GLP-1 gospel.
The one gospel. Spreading the gospel.
Where's my
love it.
tambourine?
I love it. I love it. I was on a live one night and Dave, man on the Mounjaro, if you don't follow him, do it. He's a great show here on YouTube.
He does.
And,
I just subscribed to him.
He jumped on.
Yeah.
You just did? Yeah. And he
Good.
you got on my TikTok or my live, and he was like, "You're just helping us spread the GLP-1 gospel." I was like, "Oh my God, we totally are GLP-1 evangelists. That's totally what we do."
Total.
I mean, listen, hallelujah. All day, every day.
It's like, hey, yeah.
Well,
But,
I am going
yeah.
to do my classic sign off because I don't really have an NSV other than my scale didn't move. And then when I put on jeans I wore a couple of weeks ago that I couldn't button, I could, which I feel like is good in terms of inches.
That's good.
And they're a size 16.
That is
fat
loss
but-
over weight loss. You got to think of it that way.
Yes,
Fat
yes.
loss
That's
versus
it.
weight loss.
Fat
I'll
loss
take it.
over weight
I'll
loss.
take it. I'll take it. I've been a super busy girl lately, so I'll take it. And
Mm-hmm.
I think JT's marathon on a sprint is always really good since she ain't gonna say it. And
It's a
pasta la
marathon, not a
pasta.
sprint.
That's right. There she goes. All right. Well, now I got to fill the gap. You're not alone. It's not your fault. Pasta la pasta. And we'll see you next week.
See ya.
Bye.
Bye.
We need outro music or something. Oh, you know what we need?
Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again, and the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our link tree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our link tree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussides with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussides with a Z, making healthcare work for you. Check out the link in our show notes for more details.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together, because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.